My main areas of specialism are cataract surgery, including premium lenses, multifocals, torics, that sort of thing, and glaucoma. I do all the glaucoma surgery in this area, both on the NHS and privately. I get a variety of patients coming to see me, typically glaucoma patients once that diagnosis is made. Some of them I've been looking after for over 20 years, so you get to know people pretty well. Depending on how stable the glaucoma is, I might see them once a year, sometimes more frequently if necessary. It's usually a half-hour consultation, and it starts off with me doing a visual field. Unusually I do them myself, which is a little bit unusual, but I like the patient interaction, and I think I can guarantee accuracy of the fields that I'm doing, which is the most precise way of monitoring their progression. Then I will examine the eye, measure the pressure, do general assessment of the back of the eye, talk to them how they're getting on with their eye drops, that sort of thing. And if things are stable, then usually an annual review will be adequate. I've been doing cataract surgery now for 30 years. I've done in that time incredibly over 20,000 of these operations. The technology has expanded over the years and improved, and we now have a variety of options to try if patients want the ability to read for near and distance. We can use multifocal lens implants, but I have particular experience with toric implants for patients with astigmatism, and they've been around now for about 10 years, and I do a lot of toric implants, so even with patients who have a small amount of astigmatism, it can make a big difference to their unaided vision, and means that it's less likely that they will need to wear glasses afterwards. Essentially, you just do a few extra measurements and then dial the lens into position during the operation, and that usually counteracts the astigmatism on the cornea. Astigmatism is where the cornea is shaped more like a rugby ball than a football. And most people will have some degree of astigmatism, but when it becomes significant, it can need to be corrected to get a successful outcome. You never really get tired of patients saying how grateful they are and how much better they can see the world, that sort of thing. And it's a pleasure to do it. It's fun, I still enjoy it. The surgery is challenging and technically demanding. So, although I've done over 20,000 cataract operations, still keeps you on your toes. At the end of the day, it's someone's sight, and they're entrusting to you. I have a subspecialty interest in glaucoma, which is a common disease. It affects about 4% of the population over 80 and 2% over 60, so very significant. Unfortunately, only half of those people know they've actually got it. Essentially, glaucoma is where the pressure in the eye is too high. Usually that means it's above a normal limit, but rather weirdly you have some patients whose pressures are never very high, but they still have damage to the optic nerve. So pressure is a risk factor, and essentially the way we manage it is to try and lower the intraocular pressure. And if you can achieve that, then they're not going to go on and damage the optic nerve, which starts to cause them to lose their peripheral visual fields. So ultimately, if glaucoma is not controlled, patients can end up with tunnel vision, and that has serious implications in terms of their ability to drive and all sorts of other aspects of daily living. But it's a very pernicious problem, because by the time you have symptoms, it's far too late, because you're not really aware that your visual field is deteriorating, and it just sort of creeps up on you. So once you know you've got a problem, it's generally quite advanced disease. The other aspect with the glaucoma is a longer term one. So with glaucoma patients, as I said, you're following them for basically essentially the rest of their life. And I often will say to patients that their older self will thank them if they get it right now. So if they get their pressures under control, take their drops, treat it seriously, then when they're older they should maintain their visual field, be able to drive and see quite well into old age. Typical treatment, most patients do very well with eye drops. They don't need any other intervention, either 1 or 2 drops a day, and as long as they take them religiously every night or whenever they need them, then they're usually pretty safe. We have other options in terms of laser treatment and ultimately surgery if the pressure remains uncontrolled and the visual fields are continuing to deteriorate. The vast majority of patients maintain good vision during their lifetime. Some patients, even if the pressure comes down, they struggle, and it's important to remember that, but they are a very small minority. I've worked at Circle since 2010 when it first opened, so I think it's a superb facility. I've never worked anywhere quite like it. It has a very relaxed but professional atmosphere. From the moment you walk through the door, staff greeting you at the desk, through the cafe facility, surgeons, nurses, it's just very well run, and I just think it's a centre of excellence. When I work in theatres here, everything is driven towards making you efficient, getting your list done in a timely fashion. It's just a pleasure to work here. And at the end of the day, it's something incredibly important to patients, their sight. So it's a privilege to be allowed to operate on them and hopefully get successful outcomes.